Hi, I'm Jeanette Benigas, the owner of Fix SLP, and welcome to Fixing the Code Chaos series. This is installment 2. We are talking about NCCI edits and how those apply to the new code set. If you missed the last one, here's a review of all of the new codes. Whether option B from our team is chosen or the original codes from option A, these codes will not change, and neither will the 30-minute base times or 15-minute add-ons. If you haven't yet, please hit subscribe below. This is the best way that we can reach people off social media. We still have a lot of clinicians to reach, so help us spread the word. What are NCCI edits? Well, NCCI stands for National Correct Coding Initiative. This was designed by CMS, which is Medicare and Medicaid, to prevent unbundling, so billing separate parts of a procedure when they are considered one service. It helps to reduce improper payments and standardizes coding nationally. CMS is in charge of this. There are two major types of NCCI edits. The first is procedure to procedure, or PTP. This determines whether two codes can be billed together. This is important for speech-language pathology because we have timed and untimed codes, and we aren't going to know how we can bill those until the PTPs come out. The second is medically unlikely edits, or MUEs. This limits the number of units that are considered reasonable for a code on one day. For example, billing 5 units of voice and resonance may not be appropriate, so that would limit our ability to do that. CMS oversees the program, but the edits are developed and maintained by contractors working through CMS under the NCCI program. The edits are based on CPT coding guidelines, CMS policy, clinical standards, anatomy and physiology, and existing national and local coverage policies. There are 3 parts to all of this. You may already be familiar with the first 2 parts, the AMA, which created all of these codes on the recommendation of ASHA, and CMS, which determines the Medicare payment and coding rules. Then the third part of this is the NCCI, which is one of CMS's coding and enforcing systems. So when are these released? Well, the RUC, which we'll talk about in a different video, puts valuation forward. CMS can either accept or reject them. If they reject the recommendations, they'll come up with their own values. After that's done, then the NCCI edits are developed and released. Those are released 4 times a year: January, April, July, and October 1st. It's unlikely that we're going to know valuation before July 1st. So the timeline we can expect is valuation from CMS in July and then NCCI edits in October. All of this for implementation on January 1st. And no, we cannot advocate to delay by a year. That is not how the AMA operates, and they are not willing to bend on that policy. We have to be aware of these edits because it can affect which codes we can build together, whether evaluations and treatments can occur on the same day, if there are any modifiers that we have to use, and how the new codes and the new CPT structure interacts with the existing codes that haven't been changed. The CPT process and all of these NCCI edits can have downstream effects beyond just reimbursement. They can alter our billing combinations, documentation expectations, workflow, productivity training, and payer logic. So this is something to pay attention to. And as always, follow Fix SLP. We'll have all of the updates. We won't hide them from you like a certain national organization sometimes does. Again, hit subscribe or follow us on social media, and we'll see you in the next one.